Patrick Omiel is my name. I work with HISP Uganda, but I'm also a regional implementer for climate and health. And yeah, it's a pleasure.
I'm Joan Nakibuuka. I also work with HISP Uganda as a climate and health focal point.
So as a regional implementer, I've been closely working with the Uganda team. And in our work in Uganda, we've had quite an interesting experience, of course, working with the Ministry of Health, but also connecting with the meteorology. And the work with the Ministry of Health has been quite a good one because we've been able to identify key use cases that we've been able to look to work through collectively with the Ministry of Health. And specifically, we've been working with the malaria control program. We've also worked with the NCD and then the nutrition team. And we've identified quite interesting use cases that we've been able to work through with them. And we are now at a place where we should be able to roll some of the things that we've been working together.
And maybe to add to what Patrick has said is that this work was very timely because it came at a point where we had launched the HNAP as a country. And this work speaks so much to the implementation of the HNAP in terms of the component of integration of climate and health. And also the disease cases that we really picked out were speaking to the disease cases that are quoted within the HNAP. So it's been very interesting working with the disease programs to co-create some of the work that we have here, including the suitability, including risk mapping for malnutrition, and also early warning for NCDs. So the HNAP is a Health National Adaptation Plan, which is meant to guide countries on how to respond and build climate-resilient health systems. This is supposed to be a collaboration of a number of key stakeholders across the entire spectrum of health. And in Uganda, it was launched last year, Uganda being the second country to have the HNAP. And we've been really privileged to work together with the Ministry of Health focal point within the Environmental Health Department to support its implementation.
I think what we've seen is, more like the social component of the interest from the ministry and the expectation. I think there's a lot going on in the country, but that is not well guided with data. And of course, us showing up and being able to at least show something that relates to data, climate data has created a lot of interest in the country. And that, of course, puts us in a place where we have to do more to ensure that we have really products that can inform action. And that is something that we need to, of course, work through to ensure that we have something that can help countries to basically be able to implement their national adaptation plan. So, yeah, that for me is really something that is quite interesting, seeing that from the countries. I think the overall goal is really a resilient health system. I think that's what we are all working towards. And, every contribution towards that is a good thing. And data being the thing that drives the action that leads towards that is very important. And I think us being able to make that contribution.
For working with the health programs that we've so far worked with, the expectation from them is, like Patrick mentioned, something that works, but also appreciating the process that we have to go through, because at the end of the day, they want an early warning system. They want to see predictions, but it is a process because you have to first understand how are the trends, how is the climate affecting the health, so that you're able to do the modeling. And sometimes it may not even need the modeling to make some of these decisions, like for our climate suitability use case. It's a matter of putting what we have from research into action and trying to use what we have with the products that we get from there to be able to inform the decisions for the health programs. So at the end of the day, I think for me, the process is what has really been interesting. And we're looking forward to how we can progress each of these use cases into a final product. Because at the end of the day, all they expect from the programs is an early warning system. So each of these different use cases. Yeah.
I think the next step is we've had a process of co-creation, more like engaging them, but also exploring together with them. And we've got a lot of feedback from them. So we have something. So of the 3 use cases that we have, we are ready to roll out one for now, the suitability. But we want to take it really more than just at national level, but the district level, getting it closer to places where action is taken. Yeah, so that's really where we would want to be, where we are able to now engage at a sub-national level to be able to get some of this to work at that level, because that's really where the issues are. Yeah, so we have 3 use cases that we been looking at. The first one is on malaria, and here we are looking at suitability. So basically here we're using 3 parameters, climate parameters, to be able to do like risk mapping in a way that you have this indicator that is able to give you I would say, a combination that kind of gives you a level of risk. And so you can do risk mapping for the different districts. So that is climatically suitable for malaria transmission. So we have that first use case on malaria, that's specifically looking at that. And then the other one on, Joan can speak to the one on NCD.
Yeah, so for the non-communicable diseases of interest, we have picked out the diseases related especially to air quality, where we are combining the particulate matter 2.5, the PM10, the climatic variables like relative humidity, temperature, and precipitation, and trying to see how each of those individual components and their interactions affect asthma, COPD, hypertension, and anxiety. So we are at a stage where we have done the exploration and moving into the modeling, looking at which months are really more of a concern when it comes to how climate and air quality relate to the disease outcomes of interest that we're looking at. That is for the NCDs.
Yeah, and the last one is we are really trying to explore machine learning to be able to generate, do risk mapping for malnutrition. And so with that, we're able to generate, risk scores, again, the different districts, and then be able also to know where to kind of focus when it comes to interventions that relate to intervention. So those are the 3 that we have.